So, are you afraid of being tested for HIV and other STIs because you don't like blood or needles or whatever? The great news is that most STIs only require a urine sample or a swab in order for you to be tested for them. If you get a full panel test, they will be drawing blood, but for chlamydia, gonorrhea, and trichomoniasis, you can pee in a cup and they will send that sample off for testing. For genital or oral herpes, herpes simplex 1 and 2, your doctor can swab your sores if you have them. If there are no sores present, you will need a blood test. Let's think. For syphilis, your sores can also be swabbed, or you will need a blood test if there are no sores. For HIV, you can either get a finger prick, but a lot of offices have the OraQuick oral swab, so you don't even have to have blood drawn. So I'm trying to think, which other STIs are there? Those are the most common ones. You do not have to give blood. They're not going to stick a swab in your urethra. It's not painful. It's not scary. So you should get tested. Remember, we recommend that you get tested 90 days after every risk event because that's how long it takes for HIV to show on a test. So if you have fears, just Google it. Google the little cup, Google the oral swab, and see what you will be seeing when you get to the doctor's office to help you try to combat some of that fear, because we all need to be tested, and fear of needles or blood or the doctor's office is not a sufficient reason to not get tested, especially if you are having condomless sex with multiple people. So yeah, it's not scary. They usually won't require blood, and it will let you and all of your partners know that you don't have any STIs.